I got the hormone repair manual, the modern herbal dispensary, my hormone intelligence, my medical herbalism book. Fibroids are cells and connective tissue that actually develop within the walls or the lining of the uterus. Approximately 80% of women do have fibroids in their lifetime, and even though some are asymptomatic, so they never experience, or they never even know they have fibroids, for many women it is actually symptomatic, and they do experience symptoms including abnormal uterine bleeding if you are perimenopausal or menopausal. And then if you are younger than that age, which I would say under 40, perhaps in your late 20s, early 30s, you might be experiencing something like heavy menstrual bleeding, pain in your abdomen area, as well as, or I say pain and pressure in your pelvis, as well as problems getting pregnant and having fertility issues. So before I jump into supplements and things you can consider, I think it's really important for you to know for a fact if you have fibroids and if you are experiencing fibroids, which might be causing some complications for you at this moment. I myself have had fibroids, but they were asymptomatic and found via an ultrasound. But for today, I do want to talk about not only the risk factors, but some of the supplements. But again, first thing you should do is if you have an inkling or an idea that you have fibroids or that you might be experiencing complications from fibroids, go see a healthcare provider and make sure you have the appropriate diagnosis. So some of the risk factors for fibroids is, number one, fibroids, we know that there seems to be an imbalance of the hormones estrogen and progesterone. High estrogen levels is the number one thing that is seen with, or lab results that are seen with women with fibroids. And there are several risk factors to that. Number one being the age of first menstruation. So if you experience your period before the age of 11, you have a higher risk of developing fibroids. And the reason is you're being exposed to estrogen early. Your estrogen levels are higher. And one of the things I do want to say is please check out this video about estrogen, because it will allow you to see what could be causing high estrogen levels within your system. So in addition to experiencing a period before the age of 11, we're talking about genetics as well. Genetics, if you have a mother or aunt or grandmother or sister who has experienced fibroids, your chances of experiencing fibroids are also high. We also talk about lifestyle being risk factors. And I'm not going to get into the specifics, but diet and exercise play an important role. And then also the number of pregnancies might impact. And one thing I do want to say is that Black women or women of African descent, for some reason, we have seen that women of African descent, Black women have had a higher incidence of fibroids. And so that's one thing to keep in mind, and that's one thing to make sure you're advocating for yourself if you think that all these factors might go into you experiencing fibroids. Now, let me talk about some of the supplements that are currently out in the market that have research tied to the use and the utilization of treating fibroids, or the use for trying to shrink fibroids, I should say. There are a lot of medical options and prescription drug options that are available for you that might not be where you want to go, because invasive procedures, prescription procedures, or prescription therapy, you might want to hold off on that, whether it's for lack of knowledge or lack of fear, or you want to try some naturopathic remedies first. I understand and I support you in that. So let's talk about some of the supplements and herbs that are available and that have strong research to support their use in the shrinkage and the treatment of fibroids. So the first is vitamin D3. So research has demonstrated that vitamin D3, so they reduce leiomyoma cell proliferation in vitro and also the tumor growth production in vivo in animal models. These results postulate that the potential role of vitamin D3 is very promising for the safe and effective non-surgical medical treatment options for uterine fibroids. We don't get enough vitamin D3 as women, as people of color, even though we are melanated. So that's something to consider. Another supplement that I've talked about before, and so I want you to check out the video too, because I do go into a bit of detail on how this works, is DIM, or actually bioresponse DIM. So this is a DIM that has a better bioavailability profile over pure crystalline DIM. It's shown to help some women balance estrogen, or the good estrogen in their bodies, due to the mechanism of action. And this could be helpful since uterine fibroids can be triggered by a hormonal imbalance or that high estrogen level. So please watch my DIM video and where I go into detail of how it works, how it's dosed, and who is not a good candidate. Another supplement that I think you should look into are VITEX or chasteberry or chastetree or monk's pepper. So these are many different names for the same product. They act as a hormonal normalizer and uterine tonic. The mechanism of action isn't completely understood, but it is believed through lab research to act on the anterior pituitary gland via dopaminergic receptors. So this leads to a reduction in the release of hormone prolactin, which enhances the corpus luteum development and corrects any progesterone deficiency. So in these videos here that I will link for you, I do talk about estrogen and progesterone imbalances and ways you can consider balancing your hormones. So once you're done with this video, I want you to go and watch that video. And now the last product I do want to talk to you about is green tea extract with EGCG, which is epigallocatechine galley. This plant compound called catechines may help reduce inflammation and aid in weight loss and prevent conditions like heart disease. It's also been shown to be effective in helping with the shrinkage of fibroids. Now, I know that I ran off the supplements fairly fast, but I do want to also encourage you to consider lifestyle modification, food, diet, and exercise, which should be priority for you if you're in the early stages or if it's, if this is something that has been newly diagnosed. I myself have been doing some research, and so I do want to get into more of the prioritization of how to shrink your fibroids before going the surgical or prescription route. And that's something that I've been doing a lot of research. I've dog tagged my books, my hormonal books, my herbal medicine books, which I will share here with you. I got the hormone repair manual. I've got the modern herbal dispensary. I've got my hormone intelligence, and then I've got my medical herbalism book. I have a bunch of other books that have been helpful in my research. So there's a lot of topics and a lot of information with regards to fibroids that I want to get into so that I can help you understand fibroids and how to manage them, especially if this has been a current and constant thing for you. So I do hope that this quick video has been very beneficial and helpful for you. Keep watching because I have more information coming for you, especially with lifestyle. And I do thank you for watching, and I shall see you in the next video. Take care. Bye.